Good afternoon and welcome to today's webinar, Reducing the Barriers to Swimming as Medicine. Thanks to partners Swim England and Good Boost for joining us today. We're going to kick off shortly. I'm just giving everyone a minute or two to get in. A reminder that the webinar will be recorded. Everyone that has registered will receive a copy later today or tomorrow morning. And if you've got any questions, there is a chat function just at the bottom of your screen. You should see a block for chat. You can pop any introductions, or if you've got any general tech questions or office questions in there. But if you do have any questions for our speakers today, please use the Q&A function at the bottom of the screen. We will have some time at the end of the session to be able to go through some of those questions, and some of the speakers may be able to answer some of those throughout the day. So with no further ado, I'll pass over to Andrew Power. Are you there, Andrew? Hi.
I am, Emma. Yeah. Thanks very much. So, and welcome everybody to today's webinar. I'm Andrew Power. I'm the Water Wellbeing Specialist at Swim England. I'm also joined by Kerry Watkiss, who's our Head of Insight at Swim England. For those who don't know who Swim England are or aren't aware, we're the national governing body for aquatic sports in England. So everything from swimming to diving to open water swimming as well. And we're also joined by Ben Wilkins, who's the CEO of Good Boost, who we've been working in partnership with for a good 5 or 6 years now. And we'll talk about the Good Boost program and sort of the impact of that as well as part of the presentation. So really today, what we want to focus on in the presentation, just covering a fair amount of ground. So we're going to talk very briefly about our Swimming as Medicine campaign. And the background to that. I may just need to just double check that I've put sound on as well. Yes, okay. Just a little blip there, sorry. And talk about our Swimming as Medicine campaign. We want to talk a little bit of a just update in terms of our new strategy, our vision and mission there. Some insight from our England Swims research, which is a most recent piece of research that we've conducted around the barriers to swimming in different populations and groups, and talk about our water wellbeing program as well, and how the industry is changing as a result of that, and changing in its approach and ability to be able to support health and well-being. And also, as I mentioned, a focus on Good Boost, who it's for, how that's addressing inequalities in health and well-being. And Ben will cover that and we'll have some requests at the end from yourselves in terms of calls to action as professionals and those who can be of influence in terms of this agenda. So just to introduce the Swimming as Medicine campaign, which launched on the 9th of March. Some of you may have seen it. If you haven't seen it, then you'll get a chance to watch it through. We're going to show 2 films today, short films. One was released on the 9th of March. So I'm going to go through that in a moment. And the second film, which was released just a couple of weeks ago, I'll show at the end of the presentation. The first one features Hussein Al-Zubaidi, who is a GP in Leamington Spa, and he's also the Royal College of GPs Lifestyle and Physical Activity Clinical Champion. And what we did is we did some filming with Hussein, who had some experiences with a particular patient who'd spent an extended period of time in ICU due to COVID. He'd been in intensive care, but also in induced coma for a period of time as well. He was overweight, he was unfit, and he was determined on actually surviving his ordeal and being discharged from hospital. He turned up at a running group that Hussein led in Leamington Spa one day, intent on taking part, but clearly couldn't. I think he was about 2 weeks post ITU and had a significant number of health concerns and issues. He was back in and out of hospital after that a few times as well, with different infections and so on. So he clearly wanted to do something to change his lifestyle. Hussein walked with him, talked with him, and they decided between them that the best thing for him at that time probably was to get in the pool. And so we'll have the opportunity to watch and just hear their story in terms of how that impacted on Darren. Emma, would you be able to just give me a thumbs up for comfort that you can hear everything all right?
Not hearing anything at the moment.
My number one tip
Yeah,
is
perfect.
go to your local pool, experience what it's like, experience what swimming can do for you, and then you will become an incredible advocate for the patient. When I first met Darren, he was struggling to keep at even a gentle pace. He was getting quite breathless. That was a combination of course, his baseline fitness, but also the fact that he was recently out of hospital, suffering with a respiratory infection with COVID.
At the end of February 21, I ended up in intensive care for 45 days, put me in an induced coma for 15 days, and then following discharge I had 2 readmissions from various infections. Immediately in post-recovery I had real problems with my leg function. I also had breathing issues, I was very short of breath. And then to try and address that, I started swimming.
Being able to see Darren swim in the flesh, it's not something that most healthcare professionals will ever get the privilege of doing, because as he continued to swim, you could see visibly how different he was. He was fitter, he looked younger, he looked stronger, and also more confident as well.
You know, swimming is good all-round exercise. So if a doctor's telling you to do something, that's got huge value. And I'm sure most medical professionals would say fitness is something people need to do, but you need to be reminded to do it, and you need to keep being reminded to do it.
I think it's important that we have that in the back of our mind when we are signposting patients to access the water. For many, swimming can be a really good gateway activity. Encouraging them and supporting them on that journey can be far more powerful than a number of the other interventions that we do.
Okay. So this campaign, the Swimming as Medicine campaign, came as a result of some research that we started just prior to the pandemic. We realized that swimming isn't necessarily front of mind for healthcare professionals in terms of public health campaigns and messaging and so on. And we wanted to readdress that, and we wanted to challenge that maybe perception, increase the salience of swimming, and professionals' confidence in being able to recommend swimming as an activity as well. So, as I'll mention later in our presentation, our water wellbeing program is supporting. It's there to support pool operators to become more accessible, inclusive, and welcoming. And momentum is really building. And we have hundreds of leisure operators and pool operators across the country now who are engaging in this agenda. And so the campaign is also about wanting to maximize the discussions with the patient, professional discussions, and the national discussion as well, and encouraging more professionals, healthcare professionals and otherwise, to ask, suggest, and equip people to swim and participate in aquatic activity. So our vision as an organization, we just launched our strategy recently. This is part of our all of our health and wellbeing work is part of this strategy going forward, which is really focused on allowing more people to access aquatics, which is the title of this 10-year strategy. It was launched just about a month ago, and our vision is very much about championing a healthy and successful nation. And doing so, our mission will be to enable participants to access and individuals to access aquatics so that everybody can enjoy the benefits of being in water. And there are 3 themes to our strategy, just to summarize them really quickly. The first theme around capability, and some of the elements in terms of that stream or that strand are about increasing the number of children that are unable to swim, or reducing the number of children that are unable to swim rather, and increasing the number of water wellbeing accredited sites or pools around the country that are working to this health model that we've developed. Other aims around clubs and about talent systems, but also another theme around people, and really an ambition to increase the number of people from underrepresented groups taking part and participating in swimming and aquatic activity of various types, and other themes around regulation and safeguarding as well. And we can't do any of this without water. And so the third theme very much focuses on the sustainability of pools, maintaining an appropriate supply of pools as well, and protecting the aquatic sporting infrastructure. So that's our strategy. But for the next 30 minutes or so, we're going to focus a little more on health and well-being and how we can tackle inequalities through swimming. And I'm going to hand the time over to Kerry now, who hopefully has controls, who's going to talk about some of our recent research and insight. Over to you, Kerry.
Perfect, thank you, Andrew. So I'm going to give you a quick whistle-stop tour of a piece of research that we completed last year that we've called England Swims. So a big part of our strategy that Andrew has just been through is about looking at swimming access to all, which includes underrepresented groups. We know that swimming is not representative of all demographics, and that's something that we really want to see a change in the next 10 years of our new strategy. So this piece of work was a foundation to that piece of work. It was a 4-week survey that we completed last summer, which hoped to really understand the barriers that prevented people from ethnically diverse communities to accessing water, with the aim to make aquatics more accessible and inclusive. Now, I say that we are actively targeting their people from ethnically diverse communities, and that is adults over the age of 16 who aren't currently Swim England members, so not already part of a club. These are people outside of our core audience. So it's a big shift for us to go in and reach different communities that we don't normally access and communicate with. We were targeting those who can swim but choose not to, and those who can't swim. As I say, proactively targeting ethnically diverse communities, but we did capture responses from anybody over the age of 16. Anybody over the age of 16 could complete the survey. Before I start taking you through the results, it's worth saying that we didn't actively target people with long-term health conditions, but because we had such a big response from the survey, we had 4,500 survey responses in total, we did capture quite a few people who had long-term health conditions. So about 1,300 people say they had a health condition, of which 736 say that their health condition has a substantial impact on their ability to perform everyday activities. Just seen in the comments, thank you to everybody, all of you who circulated the survey and helped us to make sure that we had a really nice sample from people with long-term health conditions, which allowed us to really delve into the findings specifically from those with health conditions. So our key findings. First, I'll talk you through ability. So we found that there is a clear disparity of swimming abilities when we analysed by ethnicity. So the national average is that 20% of people in England, adults, can't swim 25 metres unaided. 25 metres is the standard length of a normal swimming pool. But when you look at that by ethnicity, 14% of white people can't swim one length, but 49% of people from ethnically diverse communities. And that's even higher from those, the South Asian community, with 68% of South Asians can't swim one length unaided. And you'll see there on the far right of the graph, we included those who have a limiting long-term health condition. So about a quarter of those with a long-term health condition who say that it substantially impacts their ability to do daily activities can't swim 25 metres unaided. These disparities are then further exemplified by gender. So what we find is that females of all ethnicities are less likely to be able to swim 25 metres. I think the stark finding there is that South Asian females, so around 3/4 of South Asian adult females, can't swim 25 metres. As well as understanding ability, we wanted to look at capability, so the wider factors rather than just the ability to swim up and down. And what we found is that those with limiting health conditions who don't currently go swimming actually feel that they are more capable of swimming than being active generally. So here we see that 69% of them agree that they are capable of being active, but 79% of them agree that they are physically capable of swimming. This was one of the only findings where people said that there were more, one of the only demographics where people said that they were more physically capable of swimming than they were of being active. Usually for all the other demographics that we looked at, it was the other way around. People were saying that they were more physically capable of being active than going swimming. All of the health conditions showed this higher capability to swim than to be active generally. And then we move on in the survey to understand perceptions of swimming. So just looking at those who responded from an ethnically diverse community, 97% see swimming as an important skill to have, 95% believe it is enjoyable and satisfying, and 93% want to ensure their child can swim, and 92% think that swimming is a fun family activity. So we had some really, really positive perceptions of swimming coming through on the survey. However, there was also some less positive perceptions of swimming, which really guides us in our strategy and ways of working over the next decade. So of those from ethnically diverse communities, only 59% saw swimming as being accessible, 39% saw swimming as only being for particular groups of people, and only 63% say it's easy to take part in, which is lower than the white community, who are at 71%. And about 3/4 of those from an ethnically diverse community saw swimming as being a competitive activity to take part in. So lots of learnings from us there for us. And then we look at latent demand. So across the responses, we can see that about 53% of adults in England say that they want to swim more in the next 12 months. These are people who strongly agree that they want to swim more in the next 12 months, which is 24.4 million people. Of which 23%, so 5.6 million people, have not been swimming in the last year. So huge latent demand for us of non-swimmers who strongly agree that they want to swim more in the next 12 months. And of those with that limiting long-term condition, we're looking at about 1.5 million people who strongly agree they want to go swimming more. There's some really exciting figures for us at Swim England. We've then pulled out for you the 1.55 million people with long-term health conditions and shown what health conditions that they said that they had. So you'll see that long-term pain, or chronic health condition, mobility and mental health were the kind of the key health conditions that people had, of those that said that they strongly agreed that they want to swim more over the next year. So of these people who currently don't swim with health conditions, we found that it's females and the Gen Z, the 42 to 57-year-olds, that are most likely to want to swim more in the next 12 months. So that's helpful for us in our targeting activity. We then move on to barriers. So within the survey, we had about 37 barriers to swimming that we devised with a panel of critical friends, experts from all over the country from different industries that helped us pull together the list. Of those 37 barriers, we asked people to tick all that apply in terms of things that might prevent them from swimming more often. The national average was 4. So on average, people have 4 barriers when they're considering going swimming. You see that here on the very left, that those with a limiting health condition have on average 5.6 barriers. So they already have more barriers than those without a health condition. But specifically, when you look at that split then of those with a long-term health condition split by other demographics, you'll see that those from an ethnically diverse community, those that are between the ages of 16 and 41, and those in deprived areas, so IMD 1 to 3, have even more barriers. To help us understand the barriers, we use what's called the COM-B model. So this is a behaviour change theory model that we're now using in our activity moving forward. So the idea behind the model is that to do a behaviour and to encourage a person to do a behaviour, they need to have some capability, some opportunity, and some motivation. So we see these as being essentially 3 buckets. If one of your buckets is empty, we're not going to get you into the water. We're not going to get you to complete our behaviour, which is swimming. You need to have at least a little bit in all 3 buckets for us to drive your behaviour. So for us, for each demographics, for each health condition that we're looking at, or for each ethnicity or generational group or gender, we're able to split them right down and understand exactly where each of their buckets are, which buckets are empty, and what we might need to do, what we might need to target to effectively be able to increase that bucket so that we can drive their behaviour. So for this, it works really well at the kind of that really deep dive level. This isn't a deep dive level, but this is just an overview to show you how we're finding it. So this is across the board for all of those that say they have a limiting health condition. So what we can see is the capability bucket, the barriers are up on the national average by 4%, so that's at 13.7. And there are particular barriers for those with a health condition, or that's just a basic health won't allow for it. They don't feel confident in or around water, and they feel that they can't wear what they want to wear when they're going swimming. That was a theme that came out across the survey, and something that we're really going to work towards in terms of sharing appropriate swimwear. Opportunity, again, that barrier is slightly up on the national average. The largest opportunity barrier for those with health conditions is the lack of disposable income, and people also stating that swimming is too expensive. But the biggest barrier that is up on against the national average is motivation. So even though we saw earlier a really high latent demand for this group, we did find that there were some significant barriers for some of those that responded around a lack of life satisfaction. The feeling of isolation and loneliness really came out for those that have long-term health conditions, more so than any other demographic that we looked at in the survey. Also, something that we can really work on within the swimming industry is improving the confidence that people feel with instructors and lifeguards with helping people with a disability. So if we show people in advance of them accessing the water that they can have confidence in the staff that are there, yeah, that's something that we can actively work on to kind of reduce that motivational barriers for this group. So as I say, this is kind of an overview, but we've kind of got these capability, opportunity, motivation breakdowns for all of the health conditions, and we can split by things like gender and age as well to really help us to identify what we need to target for each group and how we can move forward to reduce the barriers of swimming. And we've put the link on the bottom of the slide there. So all of our research packs for this piece of work, which includes a separate pack for those with long-term health conditions, can be downloaded for free off our website. So the link is on the bottom of that slide. I'm handing back over now to Andrew for the next part of the section. Thanks. Thanks,
Kerry. So, and I'm not saying that we've solved all of the issues. As I start out on this next bit of the presentation, and the England Swims research and some of the data and learning in terms of barriers is really, really important and really will guide a lot of the work that we do from this point on. But we've gone on a long journey as an organisation. So just health and well-being for Swim England isn't a new a new entity, isn't a new occurrence. We've been involved in what's been a 12-year journey in terms of policy and strategy over the years. Our work around the Dementia Friendly Swimming Programme in 2014. We did some significant research and a series of systematic reviews in 2017 around the health and well-being benefits of swimming, which was reported back. There you can read that, and you can access that via our Health Hub on our website. And we also developed what we call our 3 frontiers approach, which was based on a number of areas in terms of other research, feeding off learning and data from our monthly swim tracker, and so on. And that had, that helped us to shape an approach to be able to support people who don't swim or people who want to swim, to be more successful and to be able to uptake more readily. And what we developed as a result is what we now know as our Water Wellbeing Programme. This was developed in 2018 as a framework for supporting people with long-term health conditions and impairments to be able to get into the water and experience the benefits. And it's a 3-stage process. The first stage, making sure that the swimming environment is accessible, inclusive and welcoming. The second stage being able to personalize and make sure that there are appropriate personalized opportunities in place for individuals that match their needs and circumstances and abilities, and also demonstrating impact and being able to focus on health outcomes, being able to demonstrate the impact of this kind of work on those outcomes. And each component of that 3-stage model is seen as essential in making the whole participant pathway successful and making that work. I want to go into a little more detail in terms of some of the components. In terms of stage 1, which is about accessibility and inclusivity, we conduct, for instance, we conduct facility audits and work through with facilities to develop improvement plans in terms of how they can make their facility more accessible, more welcoming, in terms of that physical environment. But it isn't just about the physical environment, it's also the welcome that you receive in the workforce, who are part of that fabric as well. So we've also developed some inclusive customer experience training, which is intended for all members of the team within a facility. So that could be reception staff, duty managers, lifeguards, those who might not be involved hands-on in delivering activities with individuals, but who would be involved in that journey at some stage, helping them to become more empathetic and more understanding of the needs of people with health conditions and help them to overcome some of those barriers. We look at inclusive marketing, we look at basic data collection and a commitment to that as well. And in terms of stage 2, which are the offers, and when we start to think about what it is that pools are going to offer, could it be specific instructor-led group exercise sessions in the pool or individually focused? Could it be learn to swim opportunities for those with specific targeted health needs? And then also the Good Boost program as well. And all of these activities and offers that are developed under those sort of 3 streams, if you like, are all underpinned by supporting resources, training, and various types of support to support the implementation of that. As I mentioned, impact is really important, and we've got a growing network now of over 150 pools who are all working to the same framework, gathering the basic outcome data, the same data, feeding back on business impacts, how this is further justifying their pool's existence, and developing personal case studies and stories as well to be able to show the success and the impact of their work. And I think, as Hussein has mentioned recently as well, he's a member of our Swimming and Health Commission group and supports a lot of this work. It really is. It does the Water Wellbeing Programme itself and our new accreditation scheme gives a framework to help operators to become more focused in supporting the nation to get moving through swimming, and goes quite a considerable way in giving healthcare professionals the confidence when signposting patients to a venue during discussions with patients as well. And that was an important part of the accreditation process, and the reason why, apart from customer confidence, also that healthcare professionals are confident and feel safe to be able to have those discussions and signpost individuals to these facilities. In terms of, as I've mentioned, we have 150 currently accredited sites. There are another 40 who are working towards accreditation in 2023, and a further 40 who are just starting the discussions and starting the process as well. So we expect to be, by the end of this year, to have 200 pools around the country accredited. But there are 850 public pools, and we want to be able to encompass all of those pools over this next 10 years and make sure that every pool around the country and increase the amount of access that people can experience. We've now got in the region of 20,000 hours of personalised delivery in pools across the country, and that will only grow and grow over the coming months and coming years as well. So in terms of accessibility, just as examples, in terms of some of the things that we focus on, our environmental assessment tool is a really important part of this process. In terms of accessibility, it's one of the key steps that facilities need to take to become accredited. And that's around environmental improvement, identifying the pinch points and the barriers from car park to pool, and being able to then take action on those and put those right. I think one example, as part of this, we undertook a significant piece of work and a project around pool access systems, and how new pool pod systems, pictured on the screen there, are instrumental in helping people to overcome a significant barrier, which is actually getting in and getting back out of a pool, but doing so in an acceptable and a dignified manner. If you think back maybe 15, 20, 30 years, your experiences maybe, if you can think that back far, I can, but if you can think back that far, in some cases, some of the hoist systems and some of the means of getting in and out of the pool can be quite undignified. We have over 200 hoist systems and pools around the country, but nearly as many now pool pod systems like this, automated lift systems that provide dignified access. So what we need to do is we need to talk more about that. We need to shout more about that and help people to realize that actually accessibility to pools is much improved and has much improved over the last 5-6 years. So that's one example of how we work to make the environments and facilities more accessible. But to become more inclusive, it's really important that our aquatic workforce are more competent and confident in being able to have discussions and supporting people with long-term health conditions. So there isn't the rabbit in the headlights scenario when somebody turns up at a pool and announces a plethora of health conditions that they're wanting to address and wanting to take action on. And then for the professional at the other end of the spectrum actually becoming concerned about that or worried about that and unable to understand that individual. So there are 3 products that have been developed from a training perspective. We developed an aquatic activity for health qualification, which supports exercise instructors who might be gym focused or land-based predominantly and have less experience or skill set in the pool to be able to support people with long-term conditions in the water. On the flip side, we've also developed an introduction to supporting swimmers with long-term health conditions, CPD, which is about supporting swim teachers, coaches, and volunteers who have a better understanding of water because they work in that environment on a regular basis, but don't understand the long-term health conditions that they might face or that they might need to support. And so that helps them to come to grips with that, understand the medical management, understand some of the adaptations that might need to be made with somebody who has a health condition, or specifically maybe as a joint limitation or mobility concerns, and how they can work around that and adapt to that individual. And then I mentioned at the start as well, the Activity Alliance customer experience training as well. So we've seen over 1,000 learning activities in the last year. So our workforces are becoming more competent and capable to be able to support people with health conditions. There are additional resources to support and underpin this as well. So we have resources for swim teachers on health conditions, which is a resource giving advice on joint specific and condition specific scenarios and how you might adapt swim teaching to those individuals. We've also developed a range of health fact sheets as well, which have been developed to break down some of the misconceptions that people might have about swimming. We've developed from a range of these up to 12 now. We're currently developing a 13th around stroke as well, from skin conditions to ear infections, from asthma to mental health. You can see some of the most recent versions on the screen there, swimming after COVID-19, swimming during and after cancer. before and after surgery, and the most recent swimming with musculoskeletal conditions as well, giving individuals, members of the public and professionals a little bit more of a grounding and understanding of health conditions and how it is possible to be able to swim and how you can overcome some of those barriers. And then a new resource which just launched just this week as well, just launched some poster resources and additional professional and public resources to support people who are preparing to swim, informing them and reminding of what they need to be aware of in advance to have a safe and an enjoyable aquatic experience. So things to consider, such as remembering that before you go onto poolside and you're putting your stuff in the locker, that if you need medication, if you need an inhaler for asthma, that you take that with you and that you don't leave it locked in the car or at home. Things like that become just ultimately a negative experience if something happens as a result of the person being in the pool and not being fully equipped themselves. So hopefully helping to overcome some of these additional barriers that people might experience that just result in a negative experience in the pool. And another key element in terms of the program and the Water Wellbeing program is that personalized support. Having the right opportunities to be active is really, really important, and that those opportunities are personalized to the groups and individuals who want to access pools. So it could be from aquatic exercise referral led by exercise instructors in groups or individually, through to learn to swim for either adult learn to swim or learn to swim for targeted health needs for younger groups as well. We're seeing some examples of that around the country already. And then the Good Boost system. And so far, we're now just starting to see, it's fairly early days for this accreditation scheme, but we're seeing over 1,500 participants who've benefited so far. By the end of the year, that will double, and we'll see well over 3,500 participants this year who will have benefited from this sort of support. But then that will double again next year and double the year after as we grow and grow the number of pools who are capable and supportive of these types of audiences. So we're really excited about that, and it really does show significant signs for growth over the next few years, and we want healthcare professionals and other professionals alike to take advantage of that. So I touched on Good Boost there. I'm going to hand over to Ben now, just to demonstrate how Good Boost is having a significant impact as one of the offers on this Water Wellbeing scheme, and talk you through what that's achieving. So over to you, Ben.
Thank you very much, Andrew. Is my audio coming through okay?
Yep.
Do I have control? Am I going to do next slide? Yep, there we go. I've got it. Fantastic. Hi, everyone. So yes, I'm Ben. I'm the co-founder and CEO of Good Boost. My background is in musculoskeletal research. I originally trained as an osteopath, but was more interested in community rehabilitation than working with individual patients. I'm an MSK clinical champion for Versa arthritis, and Good Boost started as a research project just over 5 years ago. And over the last 5 years, we've built it into a social enterprise that's now working across the UK. So we originally started in swimming pools in Oxford, supporting people who were on hip and knee replacement waiting lists to be active before and after surgery. Since then, we've grown to encompass much broader MSK conditions, but also around 1/5 of our participants now attend without registering a joint condition at all. They live with another long-term health conditions. And the majority of our participants that attend with a joint condition also live with multiple other comorbidities. So from pools, we moved onto land, where we have programs being delivered in gyms and in studios, and we also have a program that's delivered directly into people's homes as well. And over the last few years, we've won quite a few awards now, both nationally and internationally. Some of them joint awards with Swim England. We're NHS Digital Technology certified. We've got some great partners, and our philosophy is all about moving more, having fun, and feeling better, and providing a service which is demedicalized and isn't about the clinical outcomes. It's about feeling supported with peers in an environment that makes you want to have fun and move more. And the way we do this is we have a model where we work with leisure centres and swimming pools, so we take our rugged, bespoke designed waterproof tablets with our AI technology And we provide certified training to staff at the venue so that they can then deliver Good Boost programs in the pool and on land. And it means that we can support swimming pools, gyms, we even work in libraries, care homes, and directly to people at home for our virtual services as well. And what we've seen from our data is we are supporting some of the hardest to reach populations in terms of physical moving people from inactive to active, but also those facing health inequalities, with the majority of our participants being older adults, the majority being in their 60s and 70s. They're generally very inactive. They have a high BMI at start point. We have a really good ratio of female participants, and generally female participants are more inactive than men as they get older as well. And what we've seen from our data is that we still get a high proportion of participants who are non-swimmers or low confidence swimmers. So we're breaking those barriers for people who wouldn't traditionally see a swimming pool as a place for them to feel comfortable of coming into a Good Boost session. As mentioned, they often have 2 additional health conditions. A quarter of our participants are from low-income households, almost 2/3 register as physically inactive, and just over 1/3 report a walking mobility of less than 100 meters. And this is where programs in the water are really valuable, because individuals who wouldn't see walking as a viable offer for them can be active in the water. And this is what it looks like. This in-person services by utilising existing community venues, existing swimming pools, existing leisure centres, deliver services on land and in water, and a virtual service at home where we have hosts who will deliver virtual exercise classes at certain times of days, where we've partnered with MSK Charities to deliver that. And the emphasis is all around peer support, social support, and emotional support, because we know the practical elements that we do really well in terms of generating these personalised programs for participants in swimming pools and on land. But actually the really important elements is that peer support, social support, and emotional support. And for the instructors that we train to deliver the group classes, because they're not there to instruct the movements and exercises, that's what the animations do on the tablet computers for every single individual. You may have a class of 10 or 20 people, where each individual will be following a different exercise simultaneously. The role of the instructors is a facilitator, to be there for that social support, emotional support, and facilitate conversations to enable natural peer support to happen too. And what this looks like wet side is participants have these animations that are generated, and these are generated following an initial assessment on the Good Boost tablet computers that will ask them about their condition, their function, their preferences, their goals, and that will then generate that program. We collect ongoing data throughout every participant's sessions and at the end of their session to understand how they found the exercises, the movements, so we can keep continually evolving and adapting that program session to session for those individuals. And we deliver it on our bespoke designed and manufactured waterproof tablets that have been designed specifically for the leisure sector, so that they're waterproof, they're quick clip charging, they float, built-in stands, and they're very rugged too, because people inevitably drop them. And so our aquatic proposition focused initially in the middle with our aqua rehab program, focusing on people living with musculoskeletal conditions, but now much broader long-term health conditions. We have an aqua fitness program, which is more about goal-focused activities in the water. And we also have an aqua natal program for expectant mums, and that was developed following feedback from the sector, where leisure centres want to support expectant mums, but often don't have the skills of the staff available to do so. And dry side, it looks very similar to the pool, where everyone has their tablet computers. Every single individual will have a program specific to them. Some people prefer to be seated throughout an entire class. Some people prefer to use different exercise equipment throughout a class, like a TheraBand or plate or weights. So it means that individuals can follow a program that's designed around them, their condition, their function, the need, but also importantly, their preferences. And the great thing about that on land and in water is that, unlike a generic group activity, you're not trying to keep up with anyone else. You're going at your pace, in your way, and so it becomes much more accessible and appealing to individuals who generally wouldn't see a leisure centre or an exercise class as an activity for them. And our virtual services, we're delivering this now with local authorities, with NHS teams, as well as leisure providers. But it means that people can take part in these virtual classes at home that has a host attending to make sure it's interactive and social, and they're welcoming everyone to this virtual class. But that top half of the screen on their phone or tablet, again, is uniquely generated and designed around them. So they can take part in a program that's for their condition, for their need, for their preferences. If they have certain equipment available at home, such as a TheraBand or weight, they want to be seated for an entire class, so they can be part of a group session, but follow a program that's individually tailored to them. So we're working all over the UK in over 130 locations with some of the largest leisure providers, as well as the NHS Trust as well, as part of co-delivery to maximise and utilise these leisure centres and swimming pool spaces. And it's all about a proposition for health, but also a proposition for leisure as well, because it has to work for them to justify putting new programmes in place. There's about creating effective health and wellbeing services in leisure centres, creating pathways between doctors, physios and leisure venues. And that's part of Good Boost impact data, evaluation data, but also our kite marks, such as being NHS DTAC certified. For leisure venues, it means new populations are attending these leisure centres, which means new customers and members. So they can deliver these programs without needing an on-site physiotherapist or level 4 instructor, because that's the work we've done over the years to generate Good Boost to support these populations and be able to train lifeguards or even reception staff to facilitate rather than instruct group programs. And as we collect ongoing data, it means these venues have integrated outcome measures to evidence their impact. And we see some great changes in terms of pain, physical function, overall quality of life, the health economic benefits of delivering Good Boost in a leisure centre. We've had NHS case studies completed on Good Boost now, and exercise in water really works. What we've done at Good Boost is make it so that people can have mixed ability, mixed need, mixed condition groups, all being active at the same time, following a programme that's tailored for them. And we also, one of our goals as a social enterprise is about breaking through health inequalities and physical inactivity inequalities. Some of those being centered around ethnicity and income deprivation. And we see that at our venues, we're cutting through that inequalities. We're having a high proportion of highly diverse ethnic participants, where individuals are attending, even though this example in London, where 80% of all participants are in the lowest quintiles of the deprivation index. And the same in Sutton, where we have an ethnically diverse population engaging in Good Boost. And that's much more diverse than the local population itself, even though Sutton is generally quite a very predominantly white and a predominantly high income region of London. The participants coming through to Good Boost are far more diverse in terms of ethnicity and income. And so even in regions such as Sutton, we're still breaking through health inequality to reach the people who are at greatest risks of health inequalities. That's everything for me. Happy to answer any questions in the Q&A or directly afterwards.
Thanks, Ben. Thanks. And so I think in terms of the future, just to summarise and close today, we're expecting to see, hundreds of thousands of people over the next 10 years who are more able to access, these accessible, inclusive, and welcoming opportunities to get into the water. And offers like Good Boost will continue to grow and continue to expand, and are on quite a steep trajectory and plan for the next few years. We'll be continuing to raise awareness and visibility of the importance of water and of aquatic activity and swimming, and demonstrate the impact that aquatic activity can have on those health outcomes for individuals. Some new work that we'll be launching in August. We'll be launching a 20-minute module with NHS England and what would have been, or what used to be, Health Education England, through their eLearning for Health platform, around the health and wellbeing benefits of aquatic activity and swimming, which we hope will continue to raise awareness. That will have access and reach to the 2.2 million users of the Health platform, linked to NHS Trust learning platforms, and others as well. And I know, speaking to BSLM, we'll be able to promote it through this network too. So please do take advantage of that, and it may just open your eyes a little further in terms of some of the unique properties and unique benefits that water can actually bring in terms of health and well-being. As I mentioned at the beginning, we also have our second Swimming as Medicine film, which launched a few weeks ago. In the interest of time, I'm not going to play it. I need a few more YouTube hits today. So if you would like to venture over to our website later, to our news section, you'll be able to scroll back and watch the video for yourself and see that it features a physiotherapist in Retford and who supports individuals with various neurological conditions to be more active. And there's a Swim Together group at a local pool every Tuesday who swim together, talk together and socialize together and explain some of the personal benefits that a particular individual gets out of being in the water. So really powerful films and messages, hopefully, that will resonate with healthcare professionals of different types. We've focused on a GP example, we've now focused on a physio example, and we're hoping to cover other professional bases, nurse teams, social prescriber and link workers, and how they have had positive experiences with signposting people to the water also. And then just a last call to action to close is may have noticed on the video at the end of the video there mentions our Pool Finder system. Pool Finder is a web-based tool that will help you and your patients to identify their local pool, but also which of these pools might be best to suit their needs. So it identifies things such as pool lift systems, hoists and pool entry lift systems that might be available and provide greater access, identifies which of those pools are water wellbeing accredited, for instance. Which of the pools offer good boost sessions, dementia-friendly sessions, and other types of support. So please use that Pool Finder system in discussion with patients and with customers, whoever you work with, clients, and help them experience all that water has to offer. I think that's the end of the presentation. Thanks for listening. Hopefully we might see some of you at the conference in September as well, but I'll hand back to Emma.
Hi, thanks very much. Yeah, that was great. I think it's so reassuring to see the numbers of those that are showing an interest and wanting to get into the pool in the next 12 months. And I know that many of the BSLM members are working in many deprived communities or communities with many diverse demographics. So hopefully this would have enabled them to have a little bit more of a detailed conversation, more targeted conversation with those living with long-term conditions, as well as, more a preventative approach, those that are just interested in moving a little more. So that's great. I'll have a look at the questions. We've got 2 questions there. How do we access the CPD?
Yeah, the CPDs, the Introduction to Supporting Swimmers with Health Conditions, CPD, that is offered by the Institute of Swimming and other training providers. It's a Swim England qualifications CPD, so accredited CPD. If anybody just wants to get in touch with me, my email's on the screen there, andrew.power@swimming.org. If people are interested in that and see, I think Chris has asked about it as well, just drop me an email, Chris, and I'll send you through the links. But Institute of Swimming are one of the providers of that CPD. There's another one. I think there's a CPD being delivered on the 17th of July. There's another one in August, September. So they're pretty much at least every month at the moment, and have been really popular since the beginning of the year, since it was launched.
Super, thanks. And another one, how do we access the resources to help promote these benefits across the health professional networks?
Just in terms of resources, I mean, there is a wealth of resource. Specific, a lot of the resources are focused on our pool operators. So the resources are there to help them to implement these participant pathways for people with health conditions. There are some public resources. So there are two parts of our website. There's a Swim England website, and there is the public facing aspect to our website, which is called Just Swim. And the Just Swim website is where we host or where we hold a lot of our health fact sheets and other public resources as well. In terms of the Swimming as Medicine campaign, one of the differences with this campaign is that we've made the resources and the video assets freely available to healthcare professionals to use in your own settings, and maybe on your own embedding on your own website or on other resources that you might have control over. We want to, that they weren't about getting more individuals to realize the benefits. It was about encouraging healthcare professional to healthcare professional. So peer-to-peer kind of communication. So if anybody wants access to the Swimming as Medicine resources as well, they can just send me an email, and I can send a toolkit which has a link to a box folder where you can download the video assets, the two videos that I've mentioned, the one at the start which we watched and the one that I'm trying to encourage everybody to give me some more clicks on YouTube about.
That's great. I've put a link in the chat as well, so that's good for that. I'm going to try and launch a poll just to see, if it's something that many BSLA members are prescribing currently, or perhaps maybe more inclined to following today's webinar. Another question while that poll is live is, you highlighted some of the partners that have been working with you in many regions and sort of councils and things like that. If there's some of our members here today that are able to influence or maybe get a few more of those partners on board, where could we direct those to?
That would be me. That would be me again.
Great.
Yeah, definitely myself, and also Ben. If there's an interest in the Good Boost system and specifically, and that any opportunities there, maybe he's linking into MSK pathways and others as well. Physiotherapy services and links to services. Reduction in waiting lists and other opportunities. Then yes, get in touch with myself, get in touch with Ben, and we'll be happy to discuss further.
Brilliant. And just out of interest, we know that this is perfectly positioned for social prescribers to be able to be referring and connecting many patients with the right provider, whether that's swimming or other physical activity or social connections. Have you seen much of an impact? Are you hearing much from social prescribers, or do you get to see where these referrals are sort of coming from, or is it not something you really get to see?
No, we do. We keep a close handle in terms of communication with the sites that are accredited. One of the things we do is review their progress after 6 months in terms of how they're progressing, where the participants and pathways that have been created, partnerships that have been created. And what we've noticed is, as soon as a site announces that they've become water wellbeing accredited, as soon as they announce that maybe they're starting to promote Good Boost type activities, they've changed access or improved access to their pool, doors start to open and discussions start to happen. And we've noticed in a number of areas, particularly one of the newly accredited sites that opened in Warrington recently as well, that has quite a steady stream of individuals coming to the pool and coming to the sessions, Good Boost and otherwise, that have been set up there from social prescribing link workers directly. So yes, so the social prescribing link worker teams out there in PCN across primary care networks are starting to get certainly have a good, strong understanding of the benefits that water can provide. And we've got a few case studies as well that we've come across over the last couple of years of social prescribing link workers actually supporting people to equip people to become ready to be able to swim. Sometimes the barriers there in terms of cost, in terms of I haven't got the right equipment or costume. I don't even have a swimming costume. I can't go swimming, this kind of thing. We've got some stories where social prescribing link workers have actually gone shopping with the individual and helped them purchase the right suit or the right costume so they can then overcome that barrier and get into the water. So some great stories out there.
Wonderful. Great. Oh, I've got one more. I run a swim school and I'm currently making links with local physios, GPs, etc., with a focus on aquaphobic clients to then swim and help them with medical or MSK conditions. I'm open to links to help you to do that. Would that be through you again, Andrew?
Yeah, myself, and we have a small but perfectly formed health team at Swim England, who cover different geographical areas. So depending on where you are, just get in touch with me, and I can put you in touch with one of the relevant members of the team. We have our Learn to Swim team and our health team as well, which can support for different reasons, different purposes, can support swim schools to develop these offers as well.
Brilliant. Thanks, Joanna. Great. That's all our questions for today. Thank you very much for our speakers for joining. And of course, thank you very much to members and non-members of BSLM for joining us today.
Thanks again.
Bye-bye.